Thank you, everybody, and welcome to the orientation for our Bachelor of Allied Health. This is really exciting. As you know, this is the first time we're running the Bachelor of Allied Health in rural South Australia, so we are thrilled to have you all on board. And we're going to go through a few things today just to give you a heads up of some of the early bits of information to be aware of, but knowing that we've got all day next Thursday together. So we will be able to answer all of your questions and cover a lot more detail next Thursday. And everyone's coming on Thursday regardless of your study plan. So even if you're not doing research and study skills this semester, we still really need you to come along on Thursday for our intensive. So I'm really looking forward to seeing you all there, and we'll talk about that a little bit more soon. So this is the, we're in the College of Nursing and Health Sciences here at Flinders University, and Allied Health and Nursing and Health Science and Disability all fall under this college here. And this week is O Week, so we have our first orientation session today. So firstly, I'd like to acknowledge the traditional owners of the land in which we're meeting today. I'm meeting on Kaurna land, but I know that you're all meeting on different lands. So I'd like to pay my respects to the traditional owners and the elders past, present and emerging of all the lands in which we're meeting. And it's so lovely to have people from all over rural South Australia. So thank you for being here, and thank you to the Aboriginal people for allowing us to be here today. So I know that I've met many of you over the last couple of years as we've developed this course, but some of you I haven't met before, and your names as I received them in the emails are new. So I just wanted to give a little bit of background to where this course has come from. If you've seen me present this information before, just bear with me, I'll zoom through it, but it's just for those of you who haven't had this background before. So back in 2020, a team of us from Flinders started visiting rural and remote South Australia and also into the Northern Territory, investigating allied health challenges and opportunities that were existing, because we knew that there were a lot of recruitment and retention issues in rural and remote areas, and it has a really negative impact on communities and outcomes for consumers of health services and disability and education and aged care. And so we wanted to see if Flinders could in some way support the workforce that was needed in those areas. So we developed a co-designed rural allied health course that was came from all of our consultation that we'd done with the communities across those rural and remote areas. So the things that you learn in this course have grown from your communities and the community need, which is really exciting. And we're hoping that we develop you into really strong interprofessional and rurally focused clinicians. And we've got a great team of who's going to support you, but we're also really keen to hear your feedback along the way around what's working well, what's not working well, how we could make it better, what ideas you've got for moving forward. So there'll be lots of opportunities for you to feed into that as we go. So as you know, we are teaching in 3 regions in South Australia this year, and we hope to have more opportunities to expand in coming years. So we have students coming up to us from the Mid-North, and you will be studying at the Uni Hub in Port Pirie. We have students from across the Riverland who are studying in the Renmark Flinders Uni campus, and we have students from across the southeast who are studying in the Mount Gambier campus at Flinders. We have 3 discipline-specific qualifications that we have. So you might be in OT, physio or speech pathology. And you'll be working in interprofessional groups. So that means we'll be working with those 3 disciplines together as much as possible. And the reason we do that is because in rural areas and in best practice, health professionals work together in teams across professions. We don't work in silos where we're just physios or just OTs or just speechies. We work together for the best outcomes. So you're going to learn together so that that becomes second nature to you. And it also means that we can capitalise on small groups of students in each town that are across those 3 disciplines. You will graduate with a degree in one of those professions, but you will learn a lot with the others as you go. Our curriculum is going to be rural contextualised. So where in our city-based courses, we might think about patients at the Royal Adelaide Hospital or someone at Flinders Medical Centre or someone in a school in Adelaide, we're going to be thinking about how does all of our curriculum relate to people in rural and remote areas. So obviously you need to understand what it's like to have a patient in Adelaide or someone in Melbourne or in a city. But what we really want you to be focusing is for your given community, how can we make this work for our clients and how can we help them to meet their goals? So we're going to be working with our interprofessional groups, so the OTs, physios and speechies in each location. And through first year, all of our topics are done interprofessionally, so all three professions together. Then from second year, we'll start to have some topics that are just for OTs, some just for physios and some just for speechies. And you'll do those in your groups locally, but also connecting a lot with the other students in your discipline at the other two sites as well. So we'll be coming together online and sometimes we'll come together physically as well. We have our team of academics here at Bedford Park who are driving the topic coordination and the lectures at this stage, but we have also recruited local health professionals and educators from around your regions who are going to be doing your face-to-face teaching. So some of those are online today, but we'll meet all the rest of them next week, and you'll get to start to know them on a face-to-face weekly basis where they will teach your practicals and tutorial sessions and seminars. We'll have local placement opportunities, so you'll be able to do your clinical placements in your region. We may have opportunities for you to do placements outside of the region if that's something that we need to do to cover a particular clinical area, or if there's somewhere you'd like to go that's not in your region, we can accommodate that as well. But we've developed lots of local partnerships, which is really exciting. And we're hoping that you'll work in the region while you study. So working as an allied health assistant or a care worker, an SSO in a school, working in aged care or early intervention, childcare, something like that, where you can really be putting your learning into practice, and we'll be encouraging you to work in relevant areas while you study. One of the things that's really exciting about this course is that we've developed through that community consultation, the community really wanted us to have a flexible degree. So we have developed step out options at every year level of this course. So we're hoping that you do all 4 years of this degree and become a speech pathologist, an occupational therapist or a physio. But if you choose to step out of the degree at any other time, you can come out with a qualification, which is really exciting. So if you just study with us for this year, and then you decide to graduate, you will graduate with a higher education diploma, which we have mapped to be at a level that you would work as an allied health assistant or somewhere at that sort of level. So you'd have that strong foundation in health with some occupational therapy, some physiotherapy, some speech pathology knowledge, but a really foundational level to be able to do some work at an assistant level. If you decide after 2 years that you wanted to step out of the program, you can graduate with an associate degree and you would have some discipline-specific training. So you will have done some physio topics, for example, or some OT topics or some speech topics. So you might go on to work as an advanced occupational therapy assistant or as a disability support coordinator or something that required some basic education but not a full degree. If you decide to do 3 years of our program and graduate, you would come out with a degree that's not accredited, which means that you could go on to a different postgraduate qualification. So you might say, actually, I've learned about dietetics and I really want to become a dietitian. So you could go into the 2-year master's dietetics course or audiology or go into medicine or something else from there. And if you do all 4 years, as I said, you'll graduate as an allied health professional in one of those 3 areas. So this is really exciting for us, and we're hoping that you will come along with us on that journey and work out where that best sits for you. I thought some of you might be interested in the things we're going to cover each year. So in this first year, we're going to focus on getting to know what it's like to be a Flinders University student, and the research and study skills topic is going to introduce us to how to write at a higher education level, how to search for evidence, how to use systems and think about critical thinking and how we go in university. We're also going to do a couple of topics about allied health and interprofessional practice. We're going to have a baseline in anatomy and physiology and bioscience. We're going to do a topic all about working with Indigenous populations. We'll learn about rehabilitation and lifespan development. We're going to learn about communication as an allied health professional, and we're going to do a observational placement. Then in second year, you'll see we start to get some of that discipline-specific topic content come in, and we're also going to keep doing some things together. So we'll keep doing research topics all through the degree together, so that evidence-based practice. We're going to learn more about health services and psychological and cultural aspects of service delivery, and we'll do some placement hours again in second year, where something experiential in the placement area. Then in third year, we'll keep doing more of our discipline-specific topics. We're going to do health promotion and leadership together, and we're going to do some more evidence-based practice work together. And in that topic, we're going to start thinking about project design and project management, and we'll have a major placement in third year. Then in fourth year, we're going to think more about advanced skill development. We'll do a number of placements, and we're going to do an industry project in our transition to practice topic across the 3 disciplines. So you can see it's a really robust program where we're going to inject as much into professional work as we can, but lots of really dynamic discipline-specific topics and content as we go through. So I thought we would cover just what we're doing in first semester and introduce the people that are on the line. So I won't be able to see, I can't see who's on the line at the moment. So for the first topic, the Introduction to Allied Health and Interprofessional Practice, I am topic coordinating this one. And I'm not sure if we have anyone on the line who's tutoring into this course.
I'm here, Ali. Good timing. Just finished my lunch.
Who's that? So, oh, hi, Elise, how you going? Emily. So Elise is in Renmark, and she's going to be teaching those people that are in the Riverland. Have we got anyone else here today?
Emily just popped her hand up.
Oh, Emily, you're here.
Laura. Hello, everyone. I'm Emily, based in Port Pirie.
Thanks, Emily. And I think I've got a feeling Laura was in clinic, so I don't think she's with us.
I'm here.
Oh, you are here. Hi, Laura. Show us your face.
It's on.
Oh, there you are. Hi, Laura. Thanks very much.
Hi, everyone.
So these are the people that are, Laura's in Mount Gambier, Emily's in Port Pirie, and Elisa's in Renmark. And we also have Gareth Ferber, who is a psychologist here at the uni, who's going to be beaming in each week, talking to us about being well and maintaining our health and well-being while we study. So I don't think, is Gareth on the line? No. So we'll meet him next Friday, and we have classes for this topic on Fridays from 1 till 4, and we will have online lectures that you'll do before Friday. So I've just been recording those this morning, actually. So that's a really practical topic. We're going to learn all about what it is to be an allied health professional, an allied health assistant, and working together across teams. Now we have our research and study skills, which is our first intensive on Thursday, is just going to be this topic. And our topic coordinator is Chris Barr, who is on the line. Chris, would you like to show your face?
Hi, everyone.
I'm hoping that people can see Chris. I might just stop sharing for 1 second. There's Chris. Do we have anyone else from research and study skills on the call? Amy, you're here?
I'm here. Hi, nice to meet you.
And Francis, you're here? So Amy's in the Riverland, Francis is in Mount Gambier, and Claire, is Claire on the line? No. So you'll meet Claire in Port Pirie next Thursday. And on for the intensive, Chris is going to Mount Gambier, I'm going to the Riverland, and Tori Llewellyn is going to Port Pirie. And I think Tori is not with us this morning, but you will meet her on Thursday. Great. Okay, let me go back to where we were. So then, and so research and study skills is going to have a the intensive, and then an alternate Thursday you'll have a seminar. So that's a fortnightly session. Then we have bioscience, and I'm just wondering who we have from bioscience on the call. So Amy and Francis are teaching bioscience and research and study skills. So you've already seen those on the screen. Do we have anyone else from bioscience here? No, so that's all good. I just saw Rowena, our topic coordinator. I think she was running off to another call. So Rowena is our topic coordinator who will be running the lectures. So you'll have a number of lectures to watch each week, and then on an alternate Thursday from 1 till 4, you will have bioscience face-to-face with Chloe, Francis or Amy. And then the last topic is the therapeutic communication in allied health. And we have, I don't think we have Louisa on the call at the moment, but Louisa is going to be our topic coordinator. And do we have, oh, we have Heather there. Heather is in Mount Gambier.
Hi, everyone.
And we have Samara in Renmark and Shari in Port Pirie. Shari, I know, is in clinic, and I'm not sure if Samara is with us. I don't think so. So you're going to meet those on Friday morning, next Friday morning. Okay, so there is an online lecture to watch each week for the communication topic as well. Okay, so as I said, we're going to have our intensive on Thursday from 10 till 4, but I actually want you to come at 9:30 for your site orientation and tour. So I'm hoping you can all get there for 9:30. We're going to give you lunch, so you don't need to bring any food, but we will ask you to bring your own device. So if you can bring your laptop, that would be great, so we can help you set up your systems for navigating the Flinders University online systems. And we are going to take your photos, so be prepared for that. I did have a student in OT last year, wore a completely different hairstyle to orientation than she did for the rest of the semester, and every time I looked at her photo, it did not look like her at all. So maybe wear your hair as you would normally wear it would be helpful. So I'm looking forward to that session next Thursday. Okay, so this is the what I've just covered now, what we're going to be doing, and the reason I've got this screen, this slide up, is the part-time options. So if you are doing a full-time load, you have 4 topics each semester. And if you're having a part-time option, you would do 2. So this semester, as I said, we have research and study skills, the interprofessional practice topic, human bioscience and communication. If you're going part-time, we are recommending that you do just the research and study skills and the interprofessional topic, because they lead quite nicely onto second semester. And second semester, we have another 4 topics. We have the interprofessional practice has a IPP2. We're having care and rehabilitation across the lifespan. We're doing strength-based approaches to working with Aboriginal and Torres Strait Islander people, and we have health and social care. So we've got a really great foundation to first year. And if you are part-time, we'd ask that you do the interprofessional practice 2 and care and rehab across the lifespan in second semester. So the structure of the topics that we have, as I said, our lectures are all online. So since COVID, we have realised students asked us to keep our lectures available online. So all of our lectures in the College of Nursing and Health Sciences have online lectures. And that means that you can watch them in your own time. You can watch them where and when it suits you. You can make them go faster, you can make them go slower, you can get rid of our faces, you can just have the slides, whatever you like, how you like to watch them. So we ask that you watch the lectures for your given week before you come to class. There will be an assumption when you come to class that you've done all the preparation work before we see you in class. So that might be lectures, it might be online activities, readings, quizzes, discussion boards. So whatever is on the module to do before the practical session or the tutorial, please do those and you'll get the most out of class when you're with us. The tutorials and practicals are face-to-face and on campus, as I mentioned before. And the assignments and assessments are hugely varied. We have a whole range of different things we're going to be doing, and they're scattered throughout the semester. So I'll show you that in a moment. And we have placement, which is 100 hours in this first year. Please bring your own device each week to class because there will be activities that are online to do, or things where you need to look stuff up or take notes or watch videos and all sorts of things. So please make sure that you've always got a laptop or an iPad with you to do that. So this is just a brief snapshot of when we have assessments over the semester. So as you can see, it is quite busy around when things are due. And when you go into your Flow site, which is our Flinders Learning Online site, you'll be able to see when all of your assessments are and what they are. But I just thought it might be helpful to have an idea of when things come up. So we have tried to make it that things are scattered. You've got some things early and some things later due. And as you can see, there's all different things. So there's practical assessments, there's case studies, there's quizzes, there's presentations, there's artifacts, all sorts of things that we will get you to do, which is going to help you demonstrate your knowledge and skills as we go through. So I will have these slides available so that you can save that, or I'm sure you've got your own system for managing when things are due and what you've got coming up. Okay, so I'm hoping that we have Cara on the line from our placement team, but I'm just going to quickly explain how placements work. So we have 50 hours of observational placement in first year and 50 hours in first semester and 50 hours in second semester. Now, the reason we have built this observational placement is so that you can get a really good idea of what allied health and practice looks like, but also we wanted you to be eligible to work as an allied health assistant after first year. And if you study an allied health assistant certificate at TAFE or with a vet provider, they have 100 hours of placement in their qualification. So we didn't want people to think this qualification wasn't relevant to equivalent. So we've built in that 100 hours of observational placement. However, if you have already done a certificate 3 or 4 in allied health assistance or something equivalent, and that included a placement, if you work in a health or care or disability sector where you are patient facing, or you do something with clients, or if you have another experience that you think is relevant, we're happy to give you credit for this 100 hours of placement. You just need to contact me and explain what experience you have and why you think you should get credit for that placement. If you have that experience, you still need to do the assignment that relates to the placement, but you'll just relate your experiences to your work or to the work experience that you have. So think about if you have got that, and maybe we can talk more about that next week when we get together, and then you can contact me to explain if you think you fall into that catchment. Some of you have in the survey given me some details about your experience, which is great, and I'm happy to talk about that more. We have over 1,000 hours of placement over the whole 4 years, so this is a very small aspect of the clinical placement experiences over the degree. And you'll get to do a lot more hands-on and autonomous work as we get more experience through the program. So this first year is just observational placement. Then in second year, we're going to go out and do some activities with consumers in the community that are more over a short period of time, maybe 50 hours or so, but we'll do some targeted assessments or information gathering. Then in third year, we're going to have a placement that is a clinical placement where you will have a caseload and you'll be working as an allied health professional student. Then in fourth year, we'll have multiple clinical placements. So those will happen throughout the final year. And we also finish the year with a project placement where you do a quality improvement project with an industry partner. So there's lots of opportunity for practical learning throughout the degree. Now, Cara, are you here? So she's not on yet. I might just request her to come on. But Cara is our one of our compliance officers in the placement team, who you might have had contact with already as you've been working through your compliance work. But what we might do, Chris, is just keep going And then when Cara joins us, we can hand back over to Cara, if that sounds okay, Chris.
Yep, no problem.
Do you want me to keep sharing my screen?
Yeah, let's do that so we don't mess anything up halfway through.
Sure. Yeah.
So I'm going to just take you through a few of the sort of basic setup things that you can do to help get yourself sorted and ready to start your studies next week. Can we go next slide, please? Okay, so as Ali said, we're across 3 different campuses. I feel a bit silly telling you about your local areas, but just so that you know a few of the things that we've set up and what's available for you. Our Renmark campus is on Ralrall Avenue, which is next to the hospital. The Mount Gambier campus is next to the on the hospital grounds there. And at Port Perry, the Port Perry Uni Hub is on the main street. For each of these locations, parking's not exactly brilliant, but there's plenty of on-street parking around it. So we'll just make sure that we give ourselves plenty of time for parking and access to the different locations. If you're at the Port Perry campus, there's a student registration form. Because that's not a Flinders University specific campus, there's a few different things that are slightly different in terms of setup, but your access overall should be very similar in terms of your experience. Next slide, please. Okay, so as I said, parking around the streets can be quite tight at times, especially if there are other courses running at the same time. So in the Renmark campus, we have nursing and medicine in there, and the same around Mount Gambier. There's a medicine course, and if there's a lot going on at the hospital, parking nearby can get quite tight. So we've been asked to just make sure that you give yourself maybe 5-10 minutes just in case you have to park a little bit down the street to be able to get to the campuses. If you're on campus at Bedford Park for any reason, you need to. There's plenty of parking. There's something like 5,000 spaces around Bedford Park, but it's you do need to pay for parking through the Sello Park app. So if you're ever coming down this direction, if you need any support, just let us know and we'll point you in the right direction. Okay. One of the best resources for you is the new student section of the Compass website. So Compass is our student facing website to help direct you in the right way. If there's anything that you're stuck with or you need support for anything, this is your first port of call, and this is where you can put in any requests for any support or help. If you just do it through this, the Ask Flinders or the Flinders Connect phone call, they will direct you to the right team within either the university or the college to help support you. There is free Wi-Fi at all the different locations. So if you're on one of the Flinders campuses, the network is called EduRoam. The easiest way to join onto EduRoam, if you already have an internet connection through your phone or through a tablet, is to go to join.flinders.edu.au. If you do it through that website, then it will automatically configure your device to make sure that all your connections are up to date and ready to go. If you're not joining through that, you can join just by logging in using your username, which is your fan at flinders.edu.au, and then your Flinders password. If you've got any problems, there's the Wi-Fi website to help support you. What's really cool about EduRoam is it's the same it's the same network across just about every hospital and university, not just here but around the world. So when I was back in Europe last year, anytime I walked past a hospital or a university, my phone automatically connected me up to the Wi-Fi, which was very handy to save me on some roaming charges. If you are studying at Port Perry, they have free Wi-Fi as well. It's through the Uni Hub student Wi-Fi with the password there, and the support team up at the Uni Hub will gladly help you get set up if you've got any problems there as well. It's a good idea, if you've not done it already, to request a student ID card. You can do this through the Compass website, or there should be a request a student ID card on your Okta homepage. The student ID card will get, if you're getting it posted out to you, which I'm assuming most of you will, then that gets posted out to the address that is on the student system. So if you have set up maybe your parents' address or somewhere else, make sure that either you can access that address or you update your address on the student system. You'll need your cards. It's got a number on it that will help you access things at the library. Also, if you're in Renmark or Mount Gambier, it's a swipe card access to get into the buildings and different rooms in the buildings. So it's very important that you set those up. But you'll also want it if you want to be able to access any of the student discounts that you get by having a student card. And so it's worth getting organised as soon as possible with that. Now, looking at the enrolment system, it looks like most of you have managed to enrol in all your classes already and don't really have any problems. If you've not done it already, can you enrol in the topics that you should be enrolling in that Ali just spoke you through for first semester at least? If you've not done it already, you can enrol in the topics by logging into the student system and going into the enrolment tab and then selecting the topics that you want to enrol in. Please do not try and enrol in topics that are not on the list of topics that we have set up for this course. If you join an elective topic or a topic at a different campus, we're going to have some enrolment issues for you. There's no elective space in this course, so we need to make sure that you're enrolling in the right topics at the right time so we can scaffold your learning through the 4 years. You can also get your timetable from that tab as well. Again, if you've not already been on and done this already, it's time to get onto the Flinders Learning Online, or as we call it, Flow. This is the online teaching system that we use. We use Canvas as the background platform, so you may be familiar with that if you've used it in any other studies. I know some high schools use it as well as other universities. It's relatively straightforward to navigate through, and as we go through the topics, we'll release more and more content and information on Flow. This is where you'll be able to download readings, watch lectures, take part in discussion threads, and all the other online contact that you'll have in each of the topics. All our Flow sites for this semester are live now, which means you should be able to access them and have a look around. I would highly suggest that you spend a bit of time navigating and just getting used to the environment and understanding where you need to go in different topics and just get used to working in that system. And then if you've got any questions at the intensive, then we can help you out next week.
Chris, we've also set up a Bachelor of Allied Health Canvas site, which is for all of the topics, where we've been posting information that relates to the whole course. So please find that one as well if you haven't already.
That's right, yeah, and if you've not registered for that, then we can help you set up for that. The way we've set up these topics is we will have an individual topic that covers the 3 sites. We really want to encourage you to talk to each other across sites. So just because you're remote from each other, we want you to be able to interact and work together across the 3 different locations. And where that comes really helpful is that if you're, for example, a speech pathologist in one area and you want to talk to other speech pathology students, you'll still have contact with them through the online system. We can also do things like link up through Teams and do presentations and conversations and meetings like this one through that system as well. So we're looking for that connectivity across all the different locations. So, as I said, if you can log into Flow and start getting used to the environment, there is a generic topic called Finding Your Way at Flinders, which is an online orientation to Flow. So if you're not used it before or you want a little refresher, if you can go to that one, and it will have an online orientation for you to help get you set up. Get familiar with how the university works. Even if you've been to another university, there's always nuanced differences in how different places set things up. So just get used to the systems. figure out your shortcuts, your bookmarks, and all the different support services that we have. I would suggest you watch as many videos and look at all the support services that are all there for you. You know, Ali's introduced you to the teaching team that will be working with you on a weekly basis, but there's literally hundreds of people in the background all here to help support you in your studies and help you work towards your goal of becoming a health professional at the end of this 4 years. There are a limited number of scholarships available. They're called Destination Australia scholarships, which are designed to help people study in regional South Australia. I think for just now, eligibility is limited to Renmark and Mount Gambier because that's where some Flinders campuses are. We are working hard in the background to see if we can get some available for Port Pirie as well. I believe the scholarships are for up to $15,000 a year. The best way to find them is to go to the website there, students.flinders.edu.au/scholarships, and scroll down to the Destination Australia Awards, where you'll find all the information you need to be able to apply for them. We have safety and security on all campuses. If there's anything unacceptable or any behaviour or any issues that you would like to make a confidential report to, you can do that online through Safety on Campus. You can email the campus security, or you can phone the central phone number. Any report that you make on this isn't necessarily starting a complaint, so don't feel like you've escalated something too high by making a complaint or reporting something. If there's anything you want to be able to put through, feel free to do it. It's the first step in making sure that we can help make this a safe environment for you. The university also has a number of health, counselling and disability services. I think we'll probably cover a few more of these next week when we do the intensives. And a lot of the services, in fact, most if not all the services are available online. One of the benefits of COVID, if we can say there's been benefits, is that a lot of these services have been made available online when people weren't able to go to campus. That's a great benefit for us now when we're teaching remotely or we're teaching at different campuses that are not here at Bedford Park. So you can talk to a counsellor, a doctor or a nurse, a disability advisor. You can access some self-help resources. If you have any medical issues or anything that you would need a disability access plan for any adjustments to your studies, you can organise it through this team and then communicate it with your topic coordinators to make sure you get the help and support that you need. There's the generic phone number, which there's people staffed there 9 to 5 on weekdays, or you can email through counselling or disability. If it's something that is urgent and you need support and help straight away, then there's the after hours crisis support lines where you can phone or text for support. And we also have our university wellbeing centre, which is called Oasis. There are a number of initiatives available for every student. The Be Well plan is one of the great initiatives in this, and that is actually incorporated, embedded into one of the topics. That's the interprofessional topic, isn't it, Ali?
Yeah.
Yeah, so even if you're studying part-time, you'll be doing this topic in the first semester, first set of your studies. It's an interactive programme to help build well-being and resilience that can be used at any stage of life, but it's especially useful when you're transitioning into studying at university, perhaps for the first time, or perhaps going back to study when you've maybe not done it for a while. So it's a really good course to help with the psychological skills necessary to help your studies and to help you support yourself through your course. There are a number of other student support services which are available through the student support website. So we have student success and wellbeing advisors, equal opportunity advisors, there's the Pride Network and Good Vibes experiment. So there's lots of different groups and support structures in place. University is a fabulous way to find your place and find your group and find your people. So again, I would just encourage you to go through the different support structures and see where you sit best and what support you want and need for your studies. There's lots of online availability to help support you as well, and to follow for updates. So we've got our Instagram, Facebook, I think there's Twitter feeds as well. There's the Flinders University Student Association, and there are newsletters that will come out for students as well. It's called Ping, which will give you some student-specific information every so often to help just with as we go through certain key points through the semester and through the year to keep you updated on what's going on at the university and what key dates you need to be aware of. So reach out to any of these support services, and of course at any point in time you've also got myself, Ali and your local tutors, so if there's any questions or comments you can direct them through to us as well, and if we can't help you then we can make sure that we direct you in the right place.
Great, thank you, Chris. Now, before we jump into questions, I just wanted to join Cara in because I think you're on the line now, Cara. Are you there?
I am sorry about that.
That's
I
okay.
had the wrong time.
Oh, sorry.
No, that's all right.
I was just going to pull up. I'm hoping you can see that placement page, which is we mentioned earlier that we have this Bachelor of Allied Health Canvas flow site. So I'm hoping that everyone has seen this. But if you go into the modules down to placement compliance, this is what Cara is going to talk about now. So would you like me, Cara, if you can introduce yourself and I can open up the checklist?
Fantastic. My name is Cara Smirk and I work in the wheel support team. So we help people when they go on placement. So we just make sure that you meet all the requirements to attend placement. And unfortunately, it is a long list. So what Ali has on that you can see now is the list that we came up for this year. And fortunately with this, it will carry on, like everything you do this year. Most of it will be able to be used later on, like in your third and fourth year. I was going to say the most important ones on here to get and take the longest is the DHS clearances. And I can see that lots of students have already started doing that. So that's like really fantastic. The main thing I would say about that is get them all at the same time because it's one cost. If you do them separately, you're going to incur a separate cost each time. And the other one that takes a long time is the immunisations. Do you have, Ali, do you have the immunisation compliance document? Is the other one I sent?
Yeah. This one?
Yes, that's correct. So what we recommend is to download your immunisations from like your MyGov account, like you have it in your Medicare, or you might have your Blue Book if you're of a particular age, and take them to your GP and they can fill this out. But you can also have a pharmacist complete it or a registered nurse, but you have to have evidence of those immunisations. If you don't have evidence, you have to have a serology test, so just a blood test, and they'll check for the different diseases, vaccinations, and then the doctor will fill this out. Most students, the one that has the most difficulty is the Hep B, because most students would have had three courses of it when they were younger, and by the time you become a teenager, that you don't have the immunity anymore because you have to have a certain blood level. So you have to get a serology test no matter what to check that. And if you don't have immunity, you have to have at least a booster. And after that booster, you wait 1 month and then the serology gets checked. most people, like I think it's like 95% of people have that, but it's just that one can take up to 7 months to do. So you need to get on the immunisations like ASAP, because to attend most sites, this has to be completed. Is there anything else that they're the main ones that are the hardest?
Was I going to say, Cara, with the compliance, that if anyone has any questions about that, they can contact the CNHS placements, and that comes through to you and your team.
Yes,
but they actually upload things onto the in-place system. Is
Yes.
in-place in Okta? Is that right?
Yeah, and so I've in the emails that I've sent out, I have explained how to get there, but the guide also does that. Most students will have to add it. So when they go to Okta, you have to go add app if you can't see in place.
Yeah.
And then you have to look up placements. But this is in, I have sent that out in an email, but just in case, you have to look up placements and you see it and then you can add it. And it's just your normal password and student van that you use to get into it. And that's it. That's where you upload everything. And in addition to that, that is where lots of times, that's where you'll find out where you're attending placement, the address. If you require additional documentation, that would primarily be in place.
Yeah, fantastic. Thank you. So while we have Chris, Cara, myself, and a whole heap of staff on the line, does anyone have any questions about getting started, about doing everything that you need to do? Compliance is often something that stresses people out because we do need to have that done really quickly. So if you haven't already got started on your compliance, please do that. But I'll now open the floor to any questions that you have. Maybe we just answered them all. I'm excited to see the two sisters. We have two sisters in our course and they're both on the same call, which is very exciting. Thank you for showing your faces. Kate Burgess has a question. Come online, Kate, show us your face and talk up.
Sorry for the dark room. Oh,
That's okay.
things are going wrong. So just about the Hep B, I was wondering, so do we only need the booster or is it the whole course again, the 6 months course?
Okay, I was going to say, if you've had 3 Hep B vaccinations and then you've gone to the doctor and you've had a serology test and it comes back and you haven't had it, what we recommend everyone to do is go get 1 booster, and then 1 month from that you have to get a serology again, and most people will have it. Sometimes doctors will say they want to do the 3 courses again, but often if you've already had 3, you will have immunity after the 4th. And like, we don't want people to have to go and get an additional 2, 1 because of the expense, also the time, and you may already have immunity. But if that's what you want to do, or if that's what you've made that the doctor's pushing you to do that, then you can still do that. And I was going to say, students can still attend placement with 2 Hep Bs. Okay, so if you just need to get 2 done, but to do all your other placements, you're going to need to have at least 3 with the serology results. Okay, so if people have more questions about this, because I know that everyone's a bit different and their doctors will say different things, I'm happy to like have a look at it and like help you through it, because it is really messy and tricky. So please contact me if you have any questions about it, because it is, students and even us have difficulty with it sometimes. So please contact me and I'll help you through it. Okay.
Hope that helped, Kate.
Yes, thank you.
Isabella, have you got a question?
Yes, just a follow-up question with the Hep B. I work at Country Health Connect and I had to get my Hep B done and all that. And then I had a blood test about a month ago, but it got sent straight to pathology and I didn't get it back. So how would I go about getting that? Do you know? Or like, would I just go to the doctors and get them to?
I was going to say, have you checked your your Medicare, because you can see some of your pathology results on there. Have you checked that?
No, I have not. I
Okay,
can
so
do
you
that.
can, yeah, it depends how you set it up. Like, for example, I can see mine. So if I get a blood test, we can't see it for you can't see it for 7 days once it gets in. So you can have a look. So if you can see that and you've got it, then you can upload it. But if you can't, then you'll probably have to go see a doctor and they'll be able to chase it down.
Yep, cool, beautiful. Thank you.
That's all right.
Thanks, Isabella. We have someone else has their, oh, Ashley has her hand up.
Hi, how are you going? I just have a bit of a question about placements, probably looking sort of more into the future. Will we get sort of a bit of a rough outline of how long the placements will be sort of every year and when to roughly expect them?
Yeah, absolutely. Which course are you in, Ashley?
I'm doing speech pathology.
Okay, so yes, we will give you an outline of when all those placements will be. We're trying to be fairly flexible in terms of when they will happen, because some service providers in the rural areas want people to be part-time, some people want full-time. So we will be a little bit fluid in that, but there is there's in third year, in second semester, there's a block which is around 5 weeks, I believe, so about 25 days. And then in the final year, we will have, about 18 weeks altogether. There's quite a lot of placement in fourth year, but you will get a really clear schedule ahead of time when those are going to be, what time to book out. And as soon as when you're compliant for that year and we've allocated the placement, you'll find out where you're going, who the key contact is, what your hours will be, all of those things. So we usually do them at the beginning of the year for the year ahead, but we will definitely know the schedule well ahead of time.
Beautiful. Awesome. Thank you.
I'll just add on that. If you go to the website handbook.flinders.edu.au and then search for the Bachelor of Allied Health, you'll find the 3 different programmes and you'll be able to look at the study plans for the full 4 years for the 3 programmes. So you'll be able to see what semester different placement topics are in. And just noting that they are still in draft, so a couple of topics, I know for OT, a couple of the topics are moving when they're happening. So we just not for this year, but for future years, we're moving a couple of topics around. Thank you for posting that, Chris. Are there any other questions or comments? Or yes, Kate.
Just wanted to make sure that the Hep A is not like a thing we need, the mandatory.
Thanks, Kate. I was going to say that is only mandatory if you attend a placement in the Northern Territory.
Yeah, thank you.
So, but if you have it, get them to fill it out on the form, because then it just, there's no harm in having it on there if you have had it.
Thank you.
And Cara, if you say you decided that you wanted to go to the Northern Territory for a placement in 4th year, how long does it take for the course for Hep A?
I think it's 1 month.
Oh,
but
okay.
You can attend just with 1.
Okay.
So if you just get the 1, that they'll accept that.
Yeah, great. Thank you. Okay. Are there any other questions? Okay, that's great. So we will have lots of opportunity to answer all of your questions and get to know you really well next week. So don't worry if you haven't asked something today, or if you think of something after the session, that's completely fine as well. And as I said, I'm coming to the Riverland, Chris is going to Mount Gambier, and Tori is going to Port Pirie. So you'll get to see us and we'll do lots of work getting to know each other in the course, and also getting to know what the course is all about. And then on Friday, you'll have your 2 the IPP topic and the communication topic on Friday. And then in week 2, you'll start with bioscience face-to-face. So there's lots happening. Don't be worried if you're feeling overwhelmed or if you've got questions. I know lots of people have been emailing me, which is fine. Keep those coming, but otherwise you can hold off questions until next week as well. And we're really excited to meet you and have you on board. So thanks so much for joining us today. We will make these slides available on that Bachelor of Allied Health flow page. I'll put the slides up today, and I'll try to put the recording up as well, so that if you've missed something or you want to watch